Great.
So basically, the ear canal is a self-cleansing mechanism.
Okay.
It's like an escalator.
Okay.
So God has made it in such a way that the ear canal has got an escalator skin. So the wax comes out on its own. So you don't need to clean. So when you use a cotton bud, you're actually disrupting the escalator system. Yeah. So a cotton bud usually makes it worse. You end up pushing in the wax deeper inside against the eardrum, and that's when all the problem starts.
UM Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex, and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's QRATED podcast.
Hello everyone, welcome to QRATED, brought to you by Specialist Centre or UMSC. I am Nadia Azmi, your host. Now, QRATED is a podcast series featuring and showcasing various medical topics that are important to you no matter what age you're in or what generation you are from. And we bring in the best experts to answer your questions and your concerns. And today is a very interesting episode. You may have heard of ENT specialists, which is specialists or doctors who specialize in ears, nose, and throat, ENT doctors. But do you know that they work really closely with brain surgeons? They team up to deliver and to treat patients in the most complicated medical cases. And what they do together is that they're able to reduce scarring, speed up the recovery process, and even avoid major surgeries like open skull operations. So did you know that they work really closely together? Now, many may not have realized this, but Malaysia has one of the most advanced centers of this kind of care, which is UMSC, a leading quaternary care hospital. Today, we have two remarkable experts in the studio. We have on my left over here, they seem a little shy, but they know their stuff. We have Professor Dato Dr. Prepageran Narayanan, who is a consultant ENT head and neck surgeon from UMSC. Welcome, Prof. Prepa, to
Thank you for having me.
QRATED. Are you excited?
Well, a little bit, yes.
Yes? You don't have to be too serious. Just now I saw another side of you.
All right, okay.
And also to your left, we have Dr. Amritpal Singh Sidhu, who is a consultant neurosurgeon, also from UMSC. So Dr. Amrit, welcome to QRATED as well.
Thank you. Nice to be here as well.
Okay, what I like to ask right off the bat to all my doctors is, first of all, in your medical journey, you are a houseman, then you become a medical officer, and then there comes a time when you can specialize, and there are many areas to choose from to specialize in. So we want to ask you, maybe we can start with Prof. Prepa, why did you choose your area of expertise? How did you come to that?
It's a good question. So when I finished my medical school in 1993, and I was looking for one area to specialize in. And at that time, they just started craniofacial resections. That means they were approaching tumors under the brain at a skull-based level.
Is it in Malaysia?
No, it's in the US, in the UK,
right,
in the US.
Okay.
So they were beginning to cut open people's faces, removing like a Lego set and removing tumors inside.
Okay.
That's when it started. So I was a young medical officer at that time. And I realized that this is interesting. It's cutting edge at that time. And that made me do ENT. So I actually did ENT because I wanted to do skull-based surgery. Skull-based is actually a subspecialty of ENT.
Right.
And that's how I started into ENT.
So opening up and cutting up people's bodies, that fascinated you, that intrigued you?
But it's part of our job, though. It's, we do it to heal.
Yes.
So it's completely different.
Yes,
Yeah.
exactly. Okay, nice. What about you, Dr. Amrit?
In medical school, I always like neurology. I like how complex neurology is. And I kind of like doing things with my hands. So I started doing surgery initially. And subsequently, I subbed into neurosurgery. And I also had a close family relative who had a intracranial bleed when I was growing up.
Okay.
And everybody is helpless in that situation. So I always wanted to do that. Yeah.
Okay. So yes, it requires a lot of good hand coordination because what you do, you need to be very meticulous, very detailed. So it's not a very easy feat. It's not an easy task being a surgeon, neurosurgeon in particular, Dr. Amrit.
Yeah, definitely.
How do you train yourself to be good at it?
I think it just comes as it, as you keep doing it.
Yes. And I think the passion and the love for that field that you're in, for what you do, and the passion or the urge, the need, the desire to want to heal people really helps, I think, make you be good at what you do.
It's a long
Right?
journey though. It's
Of course.
it's a long journey. So it's like a cobbler, someone who's doing Udu Canai.
Okay.
It's practice again and again and again and again and again. So
Yes.
it's not just something that you can watch on a YouTube and do.
Of course not.
Yeah,
I hope
yeah.
doctors
So-
don't learn that
So
way.
it's a long journey to
Yes.
reach where we have come to now.
So, Prof. Prepa, you are in ENT, and then Dr. Amrit, you are in neurosurgery, which is brain, the areas of the brain. So, how do these two areas, ENT and brain, why and how do they intersect? Who shall I start with? Who comes
start.
first in this process?
So basically, everyone thinks of ENT as just the ear outside, the nose outside.
Yeah.
But it's more than that. So if you go into the nasal cavity, for example, it takes you all the way inside, next to the eye, under the brain. The same thing with the ear as well. From the ear, the inner part of the ear is just next to the brain, and the nerves go into the brain as well. So the area of skull base is the area below the brain where the bone is, and all the nerves and the blood vessels from the brain come out from the skull base area.
Okay.
So this is a very complicated, very intricate
Of course.
area. So this area, either you can approach from the top, as what neurosurgeons do, or you can go from down, from below, without
Right.
any cut or any scars in the face. So if we do it to the nostril with an endoscope, with a large camera system, with a 4K TV, or now with 8K TV with high definition, you're able to see small areas of 1 centimeter into a 40-inch television. And you're able to see very clearly the
Yeah.
anatomy and do very meticulous dissection
Yeah.
without leaving a scar in patient's face.
You get to see the inner workings
Right, yes.
of our body. And
So that's the technology
area.
that we have now.
Yeah. Okay. So where does Dr. Amrit come in from there?
So my job is to open up,
Yes.
to expose the brain to him.
Okay. Okay.
And then together we remove whatever's inside the brain, or which is the more difficult part, I think. It's more difficult, right? Yours?
So basically, last time what we used to do is do a craniotomy, means open up the skull and
Right.
try to go in and try to see these tumors wherever they are. Currently, now what we can do is through an orifice, means through the nose. Opening is made in the base of the skull, and tumors are resected via that opening, rather than
Okay.
making a huge scar and huge craniotomy in your skull.
Yes.
And that helps with recovery, helps with everything as well.
So many may not realize that actually our ears, nose, throat, it's interrelated or it's interconnected with the brain as
Yes,
well,
it is,
of
yeah.
course. So that's why you need to come together and speak together when you are treating a patient.
Correct, yes.
Figuring out what's best for the patient. Okay, now let's talk about common ENT and neuro issues. We always get sinus infections, sore throats, and so on, and they may come repeatedly. It may be a recurring thing. So when should one be worried? When we see this happening every day, it's just a normal infection. You don't have to be worried. But when should someone be concerned?
It's a good question. So if you do have for example, like sinus infection,
Yeah.
for example, you can always see a general practitioner because they're very well versed in
Yep.
this treatment. But usually what they will refer to us when the pain is persistent, when you start have bleeding, when you have a progressive nasal obstruction, or when you start having eye symptoms like a double vision, or your eyes is being proptos or beginning to come out, or swellings in the face. So anything that is progressively getting worse and persistent, then that's already a red flag there.
Persistence for how long would you say?
It's good. If it's a simple flu, for example, everyone gets it for 3 to 4 days. But if you find that usually by the second, third day, it should start getting better. If you just take over the counter. But if you start seeing that it's getting worse, your pain is getting worse, you start having blood, you start having visual disturbances, toothache.
Oh.
then you have to wonder that something is wrong. It doesn't make sense. So anything that's getting progressively worse over 3 to 4 to 5 days, I think it's always better to get it checked out.
And sometimes we like to remedy ourselves. Some people, maybe they prefer not to take any medicines and all that. Is that okay? And
That's
will that
fine.
prolong the recovery process?
No, but that's absolutely fine. So most of these sinus infections are actually viral in nature. So the first few days, you may have people just take like Panadol or paracetamol,
Yeah.
which is okay. It's understandable, right? But if it's really bad, you can't sleep, you have fever, you have myalgia, you have areas of your face that is tender, and you have blood, then it's something that you shouldn't take lightly.
Yeah, of course.
At the very least, see a general practitioner who can at least show you the right direction. There is no price tag for peace of mind.
So it's very important that we are aware of what our bodies are showing, the
Correct.
signs or symptoms, and we monitor and do something when we feel like something's not right.
Correct, yes.
Yeah. Dr. Amrit, what about from the intracranial aspect of things?
Yeah, so as mentioned earlier, the sinuses are closely related to the underlying of the brain.
Okay.
So once these infections or any other pathology in the sinuses, if they cross over to the brain, probably this is a bit late. It happens later on, but you can have things like seizures, you can have headaches, vomiting,
Okay.
yeah, and sometimes even drop in consciousness where they are a bit delirious. So that's where we can do investigations to see whether there's any intracranial extension to
Right.
these pathologies or not.
We see a lot of that happening, sometimes captured on camera. We see it on social media being circulated, people just collapsing out of a sudden, out of the blue. So it is actually could be rooted from just an infection from the ear, nose or throat that has intercepted or gone into the brain.
Yeah,
If I put it in layman's terms,
Yep, that's absolutely right.
right?
Yes, yeah.
Okay. Now, what about untreated ear infections? When I talk to doctors always say, you there's no need to take that cotton bud and clean your ears. It will just happen naturally, or you just do it on the outside and all that, right? But sometimes, yes, it happens. We get ear infections and we leave it untreated. And this could potentially become more serious and may even in certain instances require surgical intervention. Maybe Prof.
That's correct.
Prepa can elaborate.
So basically, the ear canal is
Yeah.
a self-cleansing mechanism.
Okay.
It's like an escalator.
Okay.
So God has made it in such a way that the ear canal has got an escalator skin. So the wax comes out on its own. So you don't need to clean. So when you use a cotton bud, you're actually disrupting the escalator system. Yeah. So a cotton bud usually makes it worse. You end up pushing in the wax deeper inside against the eardrum, and that's when all the problem starts. You end up digging more. Sometimes you can puncture the eardrum. But the more serious ear infections are usually from the middle ear and the inner ear.
Okay.
And it's closely linked to balance. You start getting dizzy, you start getting hearing loss, and the infection can actually go intracranial, can go inside the brain and
Right.
cause brain abscess.
Right.
So in the days before antibiotics, one of the commonest cause of brain abscess, and I think even still now, is still ear infections and sinuses.
Wow.
Untreated
okay.
ear infection and sinuses, yes.
It's like as simple as that.
Yes, as simple as that. So small things left unchecked becomes a problem.
What usually do you see in your patients most of the time that will cause these ear infections?
Usually for children, having a flu and a cold, they tend to get ear infections because of the usage in tube. But as you grow older, ear infections usually are part and parcel of sinus infections because the ear and the nose are interrelated.
Yep.
But those who have a hole in the eardrum, then when they go swimming, when the water goes into their ears, then they get an infection. But those who are diabetic, for example, where their body is not strong enough,
Right.
they're immunocompromised, then they tend to get more regular infection. And some of the more common infections for ears in Malaysia is because of the humidity we have. So we tend to get fungal infection of the ear.
Okay. And so if it's left untreated, it can become serious.
Yes,
We
it
may
can.
need-
Yes.
We may need surgery for that.
In some cases, yes, we do. Especially a bad ear infection in somebody who's diabetic.
Okay.
Then it can start spreading under the skull base. We call it molecular otitis externa, skull base osteomyelitis.
Wow.
Then it becomes very complicated because the infection goes into the bone and then it starts spreading. And in a patient who's got a diabetes that is not checked, the infection just spreads like wildfire.
Oh my. Okay, that's a massive piece of
But
info.
it's very important that if you have diabetes,
Yeah.
manage your diabetes well.
Okay.
Stay healthy. Make sure your immune is strong.
Yes.
Your body is strong. Then all your problems will be over. So the responsibility is yours, not the doctor's.
When you have a disease like diabetes, it's not just one condition that you have to treat. It can cause a whole
Correct.
plethora of other issues
Exactly, yeah.
to your body.
It's like a Pandora's box.
Exactly, yes. So, Dr. Amrit, what about when there's nerve involvement or some deeper infection and, it goes into the brain from the ear infection?
Yeah, so once it gets into the brain,
Yeah.
so there's intracranial involvement. So that makes it a bit more trickier. So we can tend to treat them with antibiotics as well. But some abscesses which are bigger, we need to drain them. So that will involve either a needle aspiration or sometimes even a craniotomy to remove these abscesses. So a simple thing like an infection from sinus or ear can lead to major surgery.
Now, brain surgeries aren't a small matter.
Yeah.
Maybe if you could illustrate, take us through. We don't want to scare our viewers or listeners, but we want to have a picture of how does that surgery process goes about when it has something to do with the brain. How do you perform a surgery on the brain, essentially?
So generally, with time, and technology, we have improved a lot. So now we have a navigation system and a microscope which helps us during surgery. So we are able to identify the exact location of the pathology, either it's an abscess or a tumor or anything. We can identify the precise area, and we can make an opening which is much smaller than before. Last time we just used to open and then we look for it. Now we can make a precise opening and we do a opening on the skin.
How
So-
big exactly would that opening be?
So it
would say?
depends on the size of the pathology. So
Right.
if the tumor is bigger, maybe a bigger opening. So
Okay.
if it's smaller, we can do a smaller opening.
Okay.
And sometimes you only need to make a small, like a 20-cent coin of opening so that we can take a lesion or aspirate a lesion. But if you're doing a craniotomy and it becomes a bit bigger, it sometimes can be a 5 by 5 centimeter
Yeah.
kind of thing. So after we remove the skin, we'll open the bone. So when we open the bone, the inner layers are the dural layer, which we have to open and resect the tumor or remove the infection, the abscess and all that.
Yeah.
Yeah. And later we just close it up. So what you see on the outside is just a single skin incision.
It's hard to imagine doing all of that if, let's say, it's as big as a 20-cent coin,
Yeah.
that you're able to do that from an opening that small.
Correct.
But you are able to with
Correct.
technology.
Yeah, certain biopsies and aspiration or abscesses. Yeah.
How risky would you say are brain surgeries? Because we know that when it comes to certain parts of the body, like your spine, your back, your brain, and you
Yeah.
perform surgeries on these areas, especially, the risk poses a lot more risk.
Yeah.
Is that true?
Yes and no. So it depends on what your comorbidities are. So some patients who are older with diabetes, hypertension, they probably fall under the high risk category. But in the brain aspect of it as well, it depends on which part of the brain is involved. So some areas of the brain is specific for the speech area. Some will be specific for your motor, it's movement of your upper limb and lower limb. So generally that makes it a bit high risk because when you do an operation there, there's a risk of weakness or risk of speech interruption. But if you're doing it in areas which are less risky, meaning they are not really eloquent, so then the risk becomes a bit lower. So
Okay.
it depends on all that.
Now, speaking of speech, we've seen some videos. We don't know how true they are, but on social media, especially people, when they're coming out of brain surgery, somehow they talk in a different accent. They become a totally different person. Is that actually possible? Just curious.
It's possible if your area, which your memory and all
Yeah,
that is
yeah.
affected. Yeah,
That can actually happen.
Yeah, that can happen.
That's amazing.
It's not common though.
It's not common.
But it's not common.
But it's more a speech,
Good.
production and your
Yes, your speech.
So that,
Yeah.
that gets interrupted more. Yeah.
Okay, interesting. Now, Prof. Prepa, you mentioned about balance issues. That has a lot to do with how the ear works, the inner workings of your ears. So sometimes people may experience this. It could
Dizziness,
be
vertigo.
dizziness or
Yeah.
vertigo.
Yeah.
People have vertigo is a very extreme situation where they feel everything is moving terumbang-ambing, we call it in BM,
Yeah,
right?
spinning. Yeah.
Things are not
Stable, yeah.
still and stable. So these are common complaints. I'm sure you see this in a lot of your patients. Could this be signs of deeper neurological or ENT related problems?
Yeah, that's why if you have persistent dizziness, it's very important to see an ENT. So you see a GP first, right? So the primary care doctors will be able to manage the simpler ones. And if they feel that it requires an ENT view or a neurosurgical view, or a neurologist, for example, then they will refer to us. So there are signs that will indicate it's not just the ear. The ear will be room spinning with some hearing loss or the humming sound in your ears. But when you start having altered conscious level, you start having numbness, reduced movements, then you know it's something more sinister. But my advice to anyone who's got dizziness,
Yeah.
if it's persistent, at least get a primary care doctor to see,
Yeah.
because it's always safe. Better to be safe than to be sorry.
Now, I've spoken to some people who have experienced vertigo, and they say it just happens
Suddenly.
suddenly,
Yes.
without warning, without any symptoms beforehand.
Right.
It just happens.
And it can be very scary because the whole world becomes upside down.
Yeah.
So, and for ear infections, it tends to come with nausea, with vomiting. So one of the things that we see, if someone is very dizzy but is quite comfortable, he doesn't have nausea and vomiting, then usually we worry about more central things, unless it's a stroke. So stroke comes with a lot of central symptoms. I'm sure Amrit can explain about stroke more. But in vertigo is very common. We see it very, very often. It's a very scary condition, but the good thing is it can be diagnosed and managed quite easily by a competent ENT surgeon.
So if it happens out of the blue, how do we
Don't
avoid?
panic. Sit down first. If you're driving a car,
Right,
pull over
yes.
to the side. Wait. Most of the time, the dizziness will settle. If it doesn't settle, just call for help. Get someone to take you to the nearest clinic and get treatment immediately. Because the last thing you want is to be driving a car or swimming when you get dizzy or scuba diving when you get dizzy.
Yeah.
Yeah. It will pass. First thing first, don't panic. Sit, rest. If you're doing something dangerous like driving, for example, pull over and stop and wait for a while. It should pass and get help.
So this is a time, I think, when we really need to listen to our bodies if something's not
Correct,
right. This is
yes.
a time to really take notice. Dr. Amrit, the balance issues, loss of balance, dizziness, persistent, constant dizziness could also mean there's a tumor in the brain.
Yeah. So it can be something which is related to an ENT pathology, meaning it's in the ear, or it could be because of something which is in the brain as well.
Yeah.
So especially in the posterior fossa of the brain, means the back part of the brain. So because that area is for your coordination. So any tumor or even a vascular lesion or even a bleed can cause balance issues, coordination issues, and all that. So that's why it's important to get any simple dizziness, even though if it's persistent,
Yeah.
to get it checked, because it could be nothing at all or it could be something. So the only way you are certain is to get it checked.
So these symptoms could also be due to maybe nerve damage. But as we know, our brain is protected by the skull.
Yeah.
How does nerve damage happen? How can injuries happen to the brain?
So basically, rather an injury is more for compression. So you can have a tumor, which most of the time is a benign tumor. So the benign tumors can grow and they can compress on the brain structures. So when they start compressing on the brain structures and even the nerves, so that's when you start developing symptoms. Yeah.
Right. Okay. Now, I'm sure at UMSC, the both of you already, are working together, teaming up. You communicate regularly with one another when you attend and treat your patients, and when you assess your patients as well. So maybe if you can share some cases, some real life cases with your patients, some stories where it really shows how the both of you collaborate really well, and having two different experts from different areas come together under one roof really will benefit the patient greatly. You could tell us, some of the experiences that you've been having.
Okay. So maybe we can tell about the case that we did yesterday. So
Okay, fresh.
So we were referred a case from a neighboring country
I see.
because the patient was having a tumor with persistent bleed. So the patient was flown over to us.
Because we have the best experts, you guys, in
We
Malaysia.
we were flown over to us
Yeah.
with by the government. by the neighboring country's
Right.
government,
Right.
where the bill is picked up by the government. So they were telling us no expense barred. You can please do whatever you can. So when the patient came in on last Wednesday. We got the medical team, the cardiologist, the medical team to assess the blood to make sure that the patient's HP was a bit low, so they transfuse blood, correct the coagulation profile and whatever not. Then we got our radiologist to do the MRI scans, and we found it was a huge tumor, vascular tumor at the skull base. So we got our intervention radiologist, Prof. Khairul is a fantastic radiologist. So he identified the blood supply to the tumor and embolized the blood supply to the tumor on yesterday morning. So yesterday evening, we both went into the operation theater. So I exposed and removed the tumor that is inside the nose and at the skull base area. And then Amrit and I together, we removed the remaining tumor at the skull base as well.
Yeah.
And we left a little bit of tumor that was stuck to vital structures, which means if we remove it, the patient may have a stroke or go blind. So we left those tumors behind.
Oh.
In a few days' time, we will refer to another neurosurgical colleague who does radiosurgery, like gamma knife, for example.
Okay.
So they will literally do radiosurgery to that area so the tumor stops growing.
Oh.
So all this is going to happen from last Wednesday, and maybe by end of this week. So the patient goes home well. So the surgeons from the country actually flew in yesterday to watch us operate. So this is like, I think the easiest analogy is a buffet, for example. Someone who's good in making pasta makes the pasta.
Yeah.
Someone who's good in doing lamb chop does the lamb chop. Then you have a full buffet. So if you come to an institution where you have people who are specialized in what they do, and everyone does what they do well at the right time,
Yep.
so it becomes like a clockwork.
You can work miracles, you can work magic.
Have you seen F1 where they change car tires?
Oh, yes.
It's like 2
In a
seconds.
matter of seconds.
Correct. It's the same. You work. If you know your boundaries, you do
Yes,
your work,
yes.
and you have mutual respect for your colleagues,
Yes.
knowing that they will do their work very well, then it becomes a 2-second tire changing like F1.
Yeah.
And that we have in UMSC because we are University Malaya, of course, is the premier university.
The story that you have told us is really pretty incredible, because in a matter of days, actually, was it even 1 week or just 1 week that all of this happened?
Came last Wednesday,
Since the
surgery
patient
was
flew in?
Monday. We just saw the patient this morning, both of us, and
Yes.
she's fine, she's well.
That's good. That's really good to hear. And do you know, before the patient was flown in, how much of the patient's history did you know?
Well, the surgeons from that country actually contacted me 2 weeks ago and said, we have this case, there's too much bleeding, we can't proceed, what do you want us to do? So they showed us the scans. So I discussed with Amrit, so we
Yes.
came up with a plan, and we told them we will book the operation theatre, we will book the ICU bed,
Right.
we will book the operation theatre, and we inform our intervention radiologists, we inform Prof. Khairul, and we inform our cardiologists. So we got everything in motion. So when the patient came, everything was set. But this is what happens regularly all the time,
Yeah.
even for Malaysians as well.
Especially, I think, for complex cases, time is always of the essence.
Correct,
So
yes.
that's why you need to be quick.
Yes.
Dr. Amrit, how long was the surgery? How many hours? Could it
Actually,
take?
it is quite all right because it went
Yeah.
as planned. So
Yeah.
you see, surgery is one thing, but the preparation prior to surgery and before
Yeah.
after surgery is also important. So the preparation before surgery was well planned out. When we had all the imaging done, we had all the embolization when blocking the blood vessels to the tumor supply, and also we had image guidance, which was essential during the surgery, a tool. So and the surgery per se, I think it was quite fast. I think
I think it was almost
hour.
1 hour.
Hour. I don't know.
Wow.
Yeah.
But like I
That's
said,
amazing.
if you do pasta regularly, you do it quite
You
fast.
can do it even with your eyes closed.
No. That's not true. But if you do pasta quite often,
Yeah.
then you can do it quite well.
Yeah.
Especially if you have a teamwork together. I mean, this is University Malaya. So you can imagine how the teamwork is.
Of course, definitely. But have you ever encountered a situation where a patient is not fit to go for surgery?
Yes. Quite often.
Yeah, definitely.
Definitely.
Maybe you
So
could tell us when that happens. And why?
usually what happens is all our patients will get assessed by the medical team
Yeah.
and the anesthetist.
Yeah.
Oh, I forgot to mention the anesthetist. We had a very good anesthetist yesterday
Yeah.
who Prof. Ina, who managed to do everything very
They
beautifully
play a
as
big
well.
role. Yeah.
And usually the medical team and the anesthetist, they will always stabilize the patient. And usually they will tell us whether the patient is fit for surgery and if the patient is amenable to surgery. So it's always a collaboration. It's never a one-person decision. Never.
Of course, it's a team.
So it's a team.
Team effort. Now let's talk about the early warning signs. We discussed a little bit previously. There's also another one where a patient can be experiencing a persistent blocked nose, nosebleeds, or hearing changes, and this can happen. I think in kids we see happening often as well. So when do these changes mean or raise red flags? When do we know that it could be something serious near the skull base, for example?
You ask difficult questions.
Really?
Anyway.
Your area of expertise is very complicated. That's why.
No, I understand. So basically, in someone, a child who's got nose block, I mean, nose block is common for children. They tend to get
It
flu.
is, yeah.
Every time they go to a new kindergarten, they go to a new class, they pick up infections. That's how they get immunity, is quite normal.
Okay.
But something that is, I think every child who got a persistent nose block must get at least examined once. At least get scoped once to make sure that we're not missing anything. The problem is the nose and the sinuses are such a big cavity that sometimes the sinister things we will only know if it's big enough to compress the brain or touch the eye. So I personally feel it's a good idea for someone who's got a persistent nose block that does not recover with simple antihistamine. Now we all sleep in aircon anyway.
Yep.
And that causes a lot of nasal congestion for
It
children.
does.
Yeah. So for someone who's got persistent nose block, maybe it's a good idea to get at least one scope. I mean, scope means examination, endoscopic examination to make sure that we're not missing anything.
Yep.
Then once we know it's just an allergy, then of course we can see whether it's because of the cats, whether it's the aircon, whether it's a soft toy they're using, and then we can tailor make accordingly. But if something that is getting progressively worse, despite seeing a GP or taking an antihistamine, for example, bleeding, progressive bleeding, swellings in the neck, facial swellings, eye changes. So these are all the danger
That's not
signs.
normal.
That's not normal.
But when you say persistent, that seems to be a key word here. I think maybe a lot of our viewers may be asking, maybe they have a child, or maybe it's themselves who are always getting these nosebleeds.
Correct.
How persistent is persistent?
So very good question. So it's also a very difficult question. So I said, I would say persistent is something that is out of normal, maybe more than 3 to 4 days, 5 days.
Back to back.
Back to back, continuously, and getting worse, progressively getting worse over 4 to
Right.
5 days.
Okay.
I believe now our health system is good.
Yes.
You have primary care, GPs everywhere. At least get it checked once. There's no price tag for peace of mind. It's always very heartbreaking when we get a huge tumor and we realize it's because they didn't go and seek treatment early.
Yep.
Yeah. There's no price tag for peace of mind.
And I think, you've mentioned about GPs or the doctors that we see maybe in emergencies, emergency departments. It's also a responsibility on them to be able to recognize these
They
red
can.
flags.
They're very well trained.
Right.
Yes, they can.
Yeah. So they know when to refer to these
Yes.
patients to yourselves,
Yes,
the
they do.
specialists.
Yeah.
Right. Okay, Dr. Amrit, why is early diagnosis and referral important, especially in conditions involving the skull base or the cranial nerves? What are the consequences if, let's say, one delays getting treatment or diagnosed? What happens to the tumor or the nerves?
All right. So, judging from the symptoms, you can do scans and determine what sort of tumor this is or where the location of the tumor is. And depending on the size, the treatment options are different as well. So, if you catch it early, meaning you do a scan early and you see a tumor, let's say it's about 1.5 centimeters. So, the treatment options are a lot different. So, you can even do radiation for that. So you don't have to do surgery.
Okay.
But if it's persistent and it's caught later on, let's say it's more than 2.5, 3 centimeters. So that's when the radiation option is not going to be there anymore. Then it becomes that the only option is to do a surgery, open surgery. So that's the reason why early detection is important, number one. And number two, because with persistent compression, other symptoms can occur. The tumors sometimes big enough, they can even compress your water channels and cause hydrocephalus, which is a life-threatening condition. And nerve damage, as you mentioned earlier, chronic compression of nerves can cause a permanent nerve damage. So if it's, let's say the seventh nerve is getting compressed, you'll have facial paralysis on one side. Yeah. So even the hearing can get affected as well. Yeah.
Okay. So that's why it's very important not to delay that hospital visit, or
At least a GP.
yeah.
At least a GP.
At least a GP,
Yes.
and see what's happening with their bodies. So what would you say? I know that you've mentioned sinister a lot. So when you see
Sinister
that
signs.
people are seeing it to be very dark and scary,
Right.
this journey, if they have something wrong in them,
Right.
but that's why it's important to seek treatment or seek help as early as they can.
Right.
So what would you say to someone who may be delaying that hospital visit or that visit to see a GP because maybe they think their symptoms are minor or there's nothing to be worried about? What's your message to them?
It's always better to be safe than sorry. We have seen a lot of very advanced, complicated cases that if we had seen them early, the surgery would have been much easier with least complication. It's always better to be safe than sorry, number one. And there is no price tag for peace of mind.
Yeah.
If you find that going to a GP is expensive, you can always go to the government setting. And I mean, we all grew up with government setting when we were younger. I mean, maybe not you. You're too young, but I did anyways. So, and it's more than adequate. So get treatment, get help. You have to look after yourself.
Of course. Thank you, Prof. Prepa and Dr. Amrit. What's your advice to those out there watching?
Yeah, as mentioned, there's no harm in just getting it checked.
Yep.
Getting it checked by a GP or any other doctor. So at least you'll have the peace of mind that it's either going to be two things. It's either going to be nothing, which will actually make you have your peace of mind, or if there's something, we would have caught it early and we can do something about it. There's always a treatment option here. Yeah.
So I think one of the key takeaways I think we can take from this conversation is that they must listen to their bodies. To our viewers and listeners out there, listen to your body. When there is something that requires your attention, you may need to make that visit to see a GP at least before you see a specialist who can further take care of you. So don't forget to QRate us by sharing, commenting, subscribing, and liking this episode. We still have more to come, more in this conversation with Prof. Prepa and also Dr. Amrit. So stay tuned.
Did you enjoy today's curated episode? Well, don't forget to tune in for the next episode of Curated Podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insights, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!